All right, let's get right into it. Chances are you're here because you got a lab result back that said positive ANA. And now your head is probably spinning with a ton of questions. It can be really confusing and honestly, a little bit scary. So that's what we're going to do here. We're going to break down exactly what this test means and, just as importantly, what it doesn't mean.
And look, first off, it is completely normal to feel worried when you see a result like that. But the whole goal of this is to cut through that confusion and give you some real clarity. By the end, you're going to understand why this result isn't a diagnosis, but it's really just a starting point.
Okay, so here is the absolute best way to think about the ANA test. It's like an airport metal detector. It's a screening tool. Its job is to be super sensitive and beep for anything that could possibly be metal. But here's the thing. It can't tell you if it's something dangerous or if it's just your belt buckle or a set of keys. It just finds stuff. It doesn't identify what it is. Keep that analogy in your head, because it's key. Now, to really get what this test is even looking for, we gotta back up a little bit. We first have to understand the players involved here. Let's talk about how your immune system is supposed to work and what happens when it kind of gets its signals crossed.
So your body is incredible. Your immune system makes these proteins called antibodies, and you can think of them as your personal bodyguards, your defenders. They're designed to hunt down and fight off invaders like viruses or bacteria. But sometimes the system glitches. It makes what are called autoantibodies. And these are defenders gone rogue. They get confused and start targeting your body's own healthy cells. The ANA test, its whole job is to look for these specific confused antibodies.
So yeah, to put it simply, an autoantibody is one that attacks self. It's a case of friendly fire. And it's this misguided attack that, in some situations, can cause the inflammation and damage that you see in autoimmune conditions.
All right, let's move on and actually look at the results. When you get a positive ANA test back, it's not just a simple yes or no. The report gives your doctor two really key pieces of information that act as important clues. These two parts are called the titer and the pattern. You can just think of them as answering two simple questions. How much is there, and what kind does it look like? So let's talk about the titer first. This number basically tells you the concentration, how much of these autoantibodies are in your blood. A low number, like a 1 to 40, is super common, even in perfectly healthy people. Now, as those numbers get higher, say 1 to 640 or more, they become more likely to be significant. But notice I said more likely, not that they are. This is still just one piece of a much bigger puzzle. The second part is the pattern. This just describes what the lab technician saw under the microscope, the shape of the staining. Now, while some patterns might be loosely linked with certain conditions, for example, a speckled pattern is sometimes seen with things like Sjogren's, these are really just clues for your doctor. They are absolutely not a diagnosis by themselves. Okay, this next section is, I think, the most important and hopefully the most reassuring part of this whole thing. Let's talk about just how common it is for perfectly healthy people to get a positive ANA result.
And here it is. This number says it all. Up to 20%. That is 1 in every 5. 1 in 5 perfectly healthy people can have a positive ANA test and have absolutely nothing wrong with them. Just let that sink in for a second. 1 in 5.
And another huge factor here is age. As we get older, our immune systems can just become a little less precise, a little less accurate, and making these autoantibodies just gets more common. So a positive ANA in someone who's, say, over 65 is way less surprising to a doctor than it would be in a teenager. And let's break those numbers down a little more. For the healthy people who do get a positive test, look at this. The vast majority of them are at a really low level. Almost a third are at 140, another 13% at 180. So what this shows us is that when a healthy person's metal detector beeps, it's usually at a very low, much less significant level. And it's not just about age or being generally healthy. So many other things can set off that metal detector. Having had infections in the past, like mono or Lyme disease, even COVID-19 can cause a temporary positive ANA. Certain medications for things like blood pressure or even some antibiotics can trigger it too. This just reinforces that a positive result can point in a whole bunch of different directions, not just one. So, given everything we've just covered, that a positive result is common and that it can be caused by all sorts of things, let's get to the bottom line. What should you actually be focused on right now? This is the million-dollar question, isn't it?
If the test by itself doesn't mean a whole lot, when does it actually become an important piece of information for you and your doctor?
And the answer is right here. A positive ANA test only starts to mean something when it's put into context. And that context is your physical signs and symptoms. The lab result all by itself is basically just noise. It's the combination of that result plus symptoms that's what creates a signal that doctors need to pay attention to.
So, what kind of symptoms are we talking about? We're talking about things like persistent joint pain and swelling that you can't explain, certain types of rashes like the classic butterfly rash across the face, really deep fatigue that just doesn't get better with rest, unexplained hair loss, or things like severely dry eyes and mouth, or your fingers changing colors in the cold. If you have a positive ANA and you're experiencing some of these things, that's when it's time for a much deeper conversation with your doctor. It's also really helpful to remember that your immune system is dynamic. It's always changing. Autoimmunity isn't some on or off switch. It's more like a fluid spectrum. Your immune system might shift towards being a little overactive for a while, and then, very often, it can shift right back toward balance all on its own. A single test is just a snapshot in time. It is not a permanent label. And that really brings us to the final, most important takeaway. Please remember this. A positive test is not a diagnosis. It's not the end of the story. It is simply the beginning of an investigation that you and your doctor are going to figure out together. So take a deep breath, arm yourself with this knowledge, and go have an informed conversation.